All right, I want to make a quick video on how we help pregnancy and how we help ladies that are pregnant, especially all the way to the end of the pregnancy. So, towards your third trimester, it's really hard to lay on your stomach, but you can see we've got some nice cushions here where she's laying comfortably on these cushions and feels good. And many times my patients say, they just love coming in and being able to lay on their stomach because it's something they lose when the belly gets bigger and more sensitive. It's really safe to adjust pregnant patients. They usually adjust a lot easier because they have oxytocin flowing through their body, and that loosens up the ligaments and gets them ready for the birthing process, but it also makes all their joints looser and less stiff. Most of my pregnant patients say they had their best pregnancy when they get adjusted regularly compared to the ones that they didn't. Most of my patients say they have far less sciatic pain, the pain that runs down the lower back to the legs. They usually tell me they can sleep better because they're less uncomfortable. And we usually help them kind of walk better too and be more upright and not have that real bad lordosis or sway back in their back when they walk too. So common things besides adjusting them is we do traction. So the lower part on the tailbone is all the parasympathetic nerves, or your relaxing nerves. So something you can do at home is just to take your palm, go right on that tailbone, and just distract up with the other one, nice and easy. This usually will relax the nerves going to the uterus and a lot of the internal organs down in this area. So it's just a relaxing approach to, therapy. And we'll just feel those muscles kind of relax in there as I apply pressure up. Other therapies we use is a rock blade. And so wherever there's tight knots, tight tension, we go in the different directions, loosening up that. Usually I go light and fast, and I go a little deeper and fast, and then we go deep and slow and really kind of knead out those muscles in there. And usually when they stand up, that low back is a lot more relaxed and feels a lot better. We also can take a thumper and work all the glutes. The sciatic nerve comes right underneath the piriformis muscle here, so this usually may be a little tender sometimes if that nerve's inflamed, but it loosens up and relaxes real easy. And then after a few treatments, this usually calms down and relaxes. But it feels good all the way up. A lot of times too, the shoulders start to round forward when you're pregnant, so you get tension spots and knots up here in the levator scapula above the shoulder blade and the rhomboids here too. So yeah, perfectly safe to get treated while you're pregnant. I've treated women all the way up to the day before they gave birth or had a C-section, and then I get them in a lot of times within a week or two after having the baby to relax things after the birth process. So if you ever have any questions, contact our office or contact us through our website at www.proactivemn.com.